My name is Deborah Marshall. I'm with Bon Secours Charity Health System, and we're very grateful for your attendance this evening. We have so many people here that we would love to introduce because as far as we're concerned, you're all dignitaries. And this is a special night, a special occasion. You're going to hear from all three of the CEOs that represent the hospitals that are forming this alliance. I will start by saying that this is one of those things that almost went viral before the press conference. We had a lot of buzz going on. Whether you realize it or not, we had 28 mentions in local media. We had 4 national mentions and 2 international mentions. We also had 8 trade journals to pick up just the buzz, and they didn't know exactly what was going on. So we're very fortunate that everyone is here tonight. We have packets on the table over here that have a press release included, and this continuum of care that we'll talk about just a little bit tonight as well. There's also a website that's been developed that you will find very interesting as we continue with this alliance and with this partnership that will be announced tonight. I would like to recognize Assemblywoman Jaffe, who has joined us tonight. Thank you so much for coming. I know it's busy in Albany these days. We appreciate all your hard work on our behalf. And if I missed anyone, would you just give me a wave as far as any of our other legislative servants? All right, great. Well, it is my privilege and pleasure to introduce Philip Patterson, the CEO of Bon Secours Charity Health System. Philip?
Thank you, Deborah. I first just want to say good afternoon and welcome to everybody here. Welcome to Good Samaritan Hospital. We're grateful that each of you have taken your time to be here for this momentous occasion. We are excited about the opportunities of how we can work together to better our communities through the work. I am joined tonight by my other CEOs, and they will talk to you a little bit later. But they are here from St. Luke's Cornwall in Newburgh and St. Francis Hospital Health Systems in Gibson. So thank you for joining us tonight. First, I'd like to recognize a few board members that are here from the Bon Secours Charity Health System. The first is Ms. Peggy Telcher. She's the president of our foundation here at Good Samaritan Hospital. I also have Dr. Richard Clarkin in the back. He's hiding, I think, but wanted to make sure that we recognized him. And then I also have a special guest here from out of town, but is the president of our board at Bon Secours Charity Health System, Sister Ann Lutz. With the support of our boards and our other organizations, we've entered into a formal collaborative that is designed to prepare us better for the future of healthcare. It's one that will allow us to be continued leaders in each of our communities as well as the region in this era of reform as we partner for high quality healthcare, to attract new providers, and to ensure that our communities continue to receive the best. I've heard of other alliances that have been formed, and I've had the privilege of seeing how this alliance has forged and how our objectives can be achieved. And without changing our boards, our mission, or our organizations individually, we find that we are made stronger through this alliance. One that is committed to best practices in the delivery of care, the opportunity of serving larger populations in the community services and education, and ensuring and strengthening the future of healthcare within these overlapping regions. I want to introduce one of the visionaries of this alliance. Next to speak to you, Mr. Alan Azrod. He's the Chief Executive Officer of St. Luke's Cornwall Hospital. I want to invite him to the podium to share more about the importance of this alliance.
Before I begin, what I'd like to do is introduce several of our board members as well. We have the chairman of our health system board, Richard Drake. We have the chairman of the hospital board over there, Doug Hovey. And a member of our our board, David Potak, right here. So, and we have David McDermott. And the chairman of our foundation, Chip Below. Oh, that's right. Chip is the boss. She's the boss. It's John. John and Chip. Chip is the head of our auxiliary, and they are extraordinary, and we appreciate you all being here. It was only 36 miles, so it's really not that far. You know, current literature is replete with the notion of collaboration. And of course, many of you who've read I know that Jason's read the 4,000 pages of the healthcare reform. You're all aware of the fact that we need to think in terms of pre- and post-hospital care. Areas that most acute hospitals don't do an exemplary job on, because that hasn't been our focus. We take care of sick people, not well people. And so that paradigm shift is really vital to what we're describing today. Some of the literature I've read, annual merger and acquisition report shows industry drive another year of merger and acquisition growth. Hospital deal-making activity is up. Considering collaboration is a trustee leader pamphlet from Haynes. And last but not least, Oppenheimer Hospital Quarterly Report, pace of acquisitions and deal-making is not to slow down. So I feel comfortable with the evolution of the partnership that we're announcing here today. Now, Bob Savage and I, Bob and I have been going to dinner for about the last decade, and yes, he does have a lot of tolerance. While we would just get together on a casual basis, talk about the world we live in, we both were out of state. And so when we first came to the community, it was nice to have a colleague that we could commiserate with and chat with. Other CEOs then came into the community, and Bob and I invited them to sit down and have dinner and break bread just to get to know one another. People do business with people whom they know. And so it was very important to develop these relationships. When the other CEOs decided to sit down, we decided that we needed some exploratory conversations, particularly in late 2010 and early 2011, as what does healthcare reform mean? Now, we still don't have an answer on that. I don't think anybody else does either. But at the end of the day, we needed to do something differently. And so we started embarking upon dialogue with a group of hospitals in Westchester. And Bob and I, independent of one another, mutually came to the conclusion that their model was not going to work for us. And so what we did is in April of 2011, we all decided to get together. And so we had met Philip through our affiliation with Mount Sinai Medical Center, because we too are affiliates of Sinai. And Philip represented the new leadership of Home Support. So with our senior leadership teams, we had dinner, and we all left with an enthusiasm, a palpable enthusiasm for what we didn't know, but for the fact that we needed to explore the unknown together. And so we decided that a physician, insurance, managed care collaboration was a direction that we wanted to refine and define. We then asked our senior staff leaders, and one of the things that we're blessed with is that all of the senior executives that sit at the table bring such a different dimension in terms of thinking, more so than we could develop just at St. Luke's Cornwall alone or Bon Secours alone. And so this collaboration worked in terms of an intellectual capacity and, hey there, intellectual capabilities that were beyond just a single organization. And so in October of 2011, we had our board members at a dinner meeting, and many of them are in attendance here today. And we decided then to go out and engage outside legal counsel. Now remember, October 2011, less than a year ago. So this is pretty remarkable. And we executed letters of intent and confidentiality agreements. From January to June, we had monthly meetings with the CEOs, as well as the developing consensus with our senior executive staffs on quality metrics, shared services, and physician initiatives. Collaboration, starting from the medical home to post-discharge. Try to discharge a patient to a nursing home at 4 o'clock on a Friday afternoon. Doesn't work. And so we needed to address those kinds of issues. And leading the operations committee of Hudson Health Partners is Will Delapina. Where's Will? The Chief Financial Officer of the St. Francis. And Will has an extensive background in the DC metro area. Our paths crossed years ago. And also in the insurance industry. A capability that we don't have at St. Luke's, but we have it now with the collaboration. And so the consensus, this is non-debatable. It's a solid business rationale. It's the right time and it's the right place. We have a cultural fit. We trust one another. We trust one another. And here we are, less than 18 months later, announcing the partnership. So with that, I'm proud of where we are as of today, and I'd like to introduce not only my colleague, but my friend, Bob Savage, President of Team.
Good afternoon. We are also thrilled to be here. And as Helen said, as the tolerant one, I was willing to go last and see what there is to continue to say. I also want to recognize some of our board members and some of our supporters from St. Francis Hospital. And first I'd like to point out Sister Rosemary Mullen, who is a member of the Sisters of St. Francis, who has worked many, many years at St. Francis in many roles. Is currently on our hospital board and our parent company board. Sister, we're also fortunate to have two sisters representing our Syracuse organization, and our Sisters of St. Francis have been part of the Sisters of St. Francis of the Newman communities. And they are also part of what's called the Franciscan Ministries, which has essentially become our parent company overall. And so I would like to recognize Sister Pat Fogel in the back and Sister Kathy Oswald. And while Alan was talking about 36 miles, Syracuse is a little bit farther, so we do appreciate your coming. I also want to recognize that we have the chairman of our board, George Whalen, over here on the left. And other members of our staff who are here. I want to recognize Jason Barlow, who is a part of the operating committee as well, working with Will. Dr. Keith Festa, our Chief Medical Officer, and George Prisco, who has helped us put a lot of this program together as well. So thank you very much. With the discussion that's already going on, I won't try to repeat a lot of things, but I hope everybody will take away kind of 3 easy words to remember in terms of what we're trying to accomplish today. First one, scale. We want to get size. We want to be able to do things. Second, costs. We've got to reduce costs. The issue is, and we all know it, that the ability of Americans to continue to afford health care insurance is getting tougher and tougher. We've hit the wall. And the average American family can't afford the average American health care policy. In addition to the fact that we all know that there are a lot of people who don't have access to insurance at all. So we have to be concerned about cost, and at the same time, as has already been said, we have to make sure that the third word is quality. We're going to be doing a better job and get better outcomes all the time. So scale, cost, and quality. And in essence then, what we're really trying to do here is bring together our resources, our clinical resources, our intellectual resources, put them together to try to get that scale that allows us to impact costs and impact outcomes and get results above and beyond what we would be able to do working alone. And that's the pure and simple theory behind all this that we're doing. How will we do that? Just talk about quality for a minute. There have already been some references, and I promise not to make this long because we can talk about it a long time. But there are a lot of issues out there. There are a lot of things available. We can, together with our resources being pooled, do shared data analytics, find out where there are gaps in outcomes or where we can improve. Some of the examples, those of you involved in hospitals know that the Centers for Medicare and Medicaid Services talks now about core measures, 14 measures that every hospital in the country is compared to. We can always improve on those. One of our hospitals, by the way, is #1 on the core measure ratings in the state of New York. That's a shareable experience, so the other hospitals can quickly do that. There are many other things, and it's already been mentioned, but one of the issues is managing along the continuum for overall improved population health and better outcomes. Another issue where we can concentrate right away, which gets a lot of attention, is preventing readmissions to hospitals. And also those of you involved in hospitals know it's a significant issue. Pretty soon, if a patient is readmitted in a hospital 30 days after discharge, there will be penalties involved. Doesn't matter if that patient goes to a different hospital, doesn't matter if the patient was in the hospital for an acute myocardial infarction, 3 weeks after discharge falls and breaks a hip, that's still a readmission. And it will hurt the hospital. So we've got to find ways to do better. The other area, again, is cost, and all we really want to do is use proved models that have been in industry and healthcare for a long time. And that is pooling our resources, pooling our purchasing power, getting that scale to reduce costs, shared contracts, common contracts for single vendors, common contracts or finding a single broker for liability and professional insurances, on and on and on. The list is almost we can do. We don't have a specific target, and tonight we're not announcing a number in terms of millions of dollars that we expect to see this year or next year, but we know that other groups that have come together and done this same thing have literally saved millions of dollars through their development and through their processes. The list is almost endless in terms of things we can do, and we have a significant number of priorities that we want to begin to work on right away. So we're anxious to do that. Again, we appreciate everybody coming tonight, the support you've shown us. We are thrilled just in terms of what Alan was describing and what Philip was talking about as well. We do work together well. We're comfortable with each other. We have the same goals. We're all, in essence, community hospitals, providers that have a mission that we want to continue. And we think that this is the best way for us to ensure that we will better serve our communities, get better outcomes, and also be more cost effective and do all the things that everybody wants us to do. Thank you very much.